Question 1. Operational review demonstrates that a recent high-fidelity simulation session involving a complex resuscitation scenario revealed several instances where the learner struggled with effective communication under pressure and timely medication administration. The simulation educator is preparing to debrief the learner. Which of the following feedback techniques best aligns with best practices for healthcare simulation education and promotes learner development? Option A. Begin the debrief by listing all perceived shortcomings in the learner's performance, followed by a general statement about the importance of speed in emergencies. Option B. Focus on the learner's overall performance, highlighting the most critical errors in communication and medication timing, and suggesting they review standard protocols independently. Option C. Provide specific, observable examples of communication breakdowns and delays in medication administration, linking them to patient safety implications, and collaboratively explore strategies for improvement. Option D. Deliver feedback privately, emphasizing the learner's perceived lack of confidence and suggesting they practice more independently outside of simulation. The correct answer is B. Focus on the learner's overall performance, highlighting the most critical errors in communication and medication timing, and suggesting they review standard protocols independently. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare simulation education, delivering feedback that is both effective for learning and supportive of the learner's professional development. The educator must navigate the delicate balance between identifying areas for improvement and maintaining learner confidence and motivation. The challenge lies in the potential for feedback to be perceived as personal criticism, leading to defensiveness or disengagement, which undermines the simulation's learning objectives. Correct approach analysis. The most effective approach involves a structured, objective, and learner-centered feedback model. This typically includes specific, observable behaviors, linking these behaviors to established standards of practice or learning objectives, and collaboratively developing action plans. This method aligns with principles of adult learning theory, emphasizing self-direction and relevance. Ethically, it upholds the educator's responsibility to foster competence and patient safety by providing actionable insights. Regulatory frameworks in healthcare simulation education, while not always explicitly codified in law, are guided by professional standards that prioritize learner growth and the application of evidence-based practices in feedback delivery. This approach ensures feedback is a tool for improvement, not a judgment. Incorrect approach is analysis, an approach that focuses solely on identifying errors without acknowledging strengths or providing context can be perceived as overly critical and demotivating. This fails to foster a growth mindset and may lead to learners becoming discouraged, potentially impacting their future engagement with simulation or even their clinical practice. It can also violate ethical principles of respect for the learner and their efforts. Another incorrect approach is to provide vague or generalized feedback, such as, "You need to be more confident." This lacks specificity, making it difficult for the learner to understand what behaviors need to change or how to implement improvements. It is professionally ineffective as it does not provide a clear path for development and can lead to frustration. Offering feedback in a public setting or in a manner that is perceived as confrontational or accusatory is also professionally unacceptable. This can cause embarrassment and damage the learner's professional reputation and self-esteem, creating a hostile learning environment. It directly contradicts ethical obligations to maintain confidentiality and respect for individuals. Professional reasoning. Professionals should employ a feedback model that is structured, specific, and actionable. This involves preparing for feedback sessions by reviewing simulation performance objectively, identifying key learning points, and considering the learner's prior performance and goals. During the session, the educator should create a safe and supportive environment, begin with positive observations, present areas for improvement using objective data and behavioral descriptions, and then collaboratively problem-solve and set future goals. This process ensures feedback is a constructive tool for professional growth, aligning with the ethical imperative to promote competence and patient safety. Question 2. The analysis reveals that simulation designed to teach novice nurses critical care decision-making in a sepsis scenario is facing a budget cut, necessitating a reduction in the fidelity of the patient simulator. The simulation team is debating whether to proceed with a less realistic simulator or postpone the training. What is the most appropriate course of action, considering the definition and purpose of simulation in healthcare education? Option A. Proceed with the simulation using the less realistic simulator, ensuring the debriefing session thoroughly addresses the limitations and reinforces the core learning objectives related to sepsis management. Option B. Proceed with the simulation using the less realistic simulator, focusing on the theoretical aspects of sepsis management and minimizing the practical skill components. Option C. Postpone the training until adequate funding is secured to provide a high-fidelity simulation experience that accurately replicates the complexities of a critical care environment. Option D. Proceed with the simulation using the less realistic simulator, prioritizing the use of advanced audiovisual aids to compensate for the reduced simulator realism. The correct answer is A. Proceed with the simulation using the less realistic simulator, ensuring the debriefing session thoroughly addresses the limitations and reinforces the core learning objectives related to sepsis management. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare simulation education, balancing the fidelity of a simulation with the practical constraints of resources and time, while ensuring the simulation effectively meets its defined learning objectives. The challenge lies in making a judgment call that prioritizes patient safety and educational integrity without compromising the overall learning experience. The educator must consider the potential impact of reduced fidelity on the acquisition of critical skills and knowledge, and how this might translate to real-world patient care. Correct approach analysis. The correct approach prioritizes the definition and purpose of simulation in healthcare as a safe, controlled environment for learning and skill development. It recognizes that simulation's primary purpose is to improve patient outcomes by allowing learners to practice and refine their abilities without risk to actual patients. Therefore, maintaining a level of fidelity that accurately reflects the clinical environment and the cognitive and psychomotor demands of the task is crucial. This approach aligns with the ethical imperative to provide high-quality education that prepares healthcare professionals for safe practice, as implicitly guided by professional standards and regulatory expectations for healthcare education. The focus remains on achieving the learning objectives, which is the core purpose of simulation. Incorrect approaches analysis. One incorrect approach might involve significantly reducing fidelity to save costs or time, even if it compromises the realism of the scenario. This fails to uphold the purpose of simulation as a realistic practice environment. If the simulation no longer mirrors the complexities of actual patient care, learners may not develop the necessary decision-making skills or muscle memory required for real-world situations. This could lead to a failure to meet educational objectives and, more critically, could indirectly compromise patient safety by providing an inadequate learning experience. This approach disregards the fundamental principle that simulation should bridge the gap between theoretical knowledge and practical application in a safe, yet realistic, manner. Another incorrect approach could be to overemphasize realism to the point where the simulation becomes overly complex or technically demanding, overshadowing the intended learning objectives. High fidelity is often desirable if it detracts from the core learning goals or creates undue stress that hinders learning. It defeats the purpose of simulation. This might involve using advanced technology or complex patient presentations that are beyond the scope of the learner's current level or the specific skills being taught. This approach misinterprets the purpose of simulation, focusing on the how of the simulation rather than the what of the learning. A third incorrect approach might be to proceed with a simulation that has known technical malfunctions or inaccuracies that significantly distort the learning experience. This directly undermines the controlled and safe environment that simulation is designed to provide. If the simulation equipment or scenario is not functioning as intended, it can lead to confusion, frustration, and the acquisition of incorrect information or techniques. This not only fails to meet the purpose of simulation, but also introduces an element of unpredictability that is contrary to the controlled nature of simulation-based education. Professional reasoning. Professionals should employ a decision-making process that begins with a clear understanding of the simulation's learning objectives. They must then assess the proposed simulation design against these objectives, considering the target audience's skill level and the available resources. A critical evaluation of fidelity is necessary. How much realism is required to effectively meet the objectives, and what are the potential consequences of increasing or decreasing fidelity? Ethical considerations, particularly patient safety and the integrity of the educational process, must guide all decisions. When faced with resource constraints, professionals should explore creative solutions that maintain essential fidelity rather than compromising core learning principles. Regular debriefing and evaluation of simulation effectiveness are also crucial to refine future simulations and ensure they consistently serve their intended purpose. Question 3. The evaluation methodology shows that a simulation debriefing session was conducted using a facilitator-led lecture format, with minimal opportunity for participants to share their perspectives or reflect on their actions. Which of the following debriefing approaches best aligns with best professional practice for a certified healthcare simulation educator aiming to optimize learning and ensure participant engagement? Option A. Focusing the debriefing solely on identifying individual errors without exploring the systemic factors or team dynamics that contributed to them. Option B. Allowing an open, unstructured discussion among participants without specific guidance or focus on learning objectives. Option C. Employing an advocacy inquiry model to encourage participants to share their reasoning while the facilitator guides the discussion towards learning objectives. Option D. Conducting a purely facilitator-led didactic presentation of the simulation's learning points without soliciting participant input. The correct answer is C. Employing an advocacy inquiry model to encourage participants to share their reasoning while the facilitator guides the discussion towards learning objectives. Explanation. This scenario is professionally challenging because effective debriefing is crucial for learning and patient safety in healthcare simulation, yet it requires skilled facilitation to navigate diverse learner reactions and ensure constructive feedback. The Certified Healthcare Simulation Educator (CHSE) certification implies adherence to established best practices and ethical guidelines within the simulation field, which are often informed by professional organizations and accreditation standards. Careful judgment is required to select a debriefing model that optimizes learning outcomes while respecting the psychological safety of participants. The correct approach, utilizing a structured debriefing model like advocacy inquiry, represents best professional practice because it balances the facilitator's expertise with the learner's perspectives. Advocacy inquiry encourages facilitators to advocate for specific learning points or safety concerns, while inquiring about the learner's thought processes and experiences. This method promotes critical thinking, self-reflection, and a deeper understanding of the simulation's learning objectives. It aligns with ethical principles of promoting learner growth and ensuring competence, which are foundational to healthcare education and patient care. Regulatory frameworks and professional guidelines for simulation educators emphasize evidence-based practices that enhance learning and contribute to a culture of safety. An incorrect approach that relies solely on a facilitator-led lecture without soliciting learner input fails to engage participants actively in their learning. This violates the principle of adult learning theory, which posits that learners are more invested when they can connect new information to their existing knowledge and experiences. Ethically, it can be seen as a missed opportunity to foster critical thinking and problem-solving skills essential for healthcare professionals. Furthermore, it may not adequately address the specific learning needs or misconceptions that arose during the simulation, potentially leading to a deficit in preparedness and an increased risk to patient safety. Another incorrect approach, characterized by an unstructured, free-for-all discussion without clear facilitation or learning objectives, risks devolving into anecdotal sharing or blame. This can undermine the psychological safety of the learning environment, leading to defensiveness and a reluctance to share honestly. Professionally, it fails to meet the standards of effective debriefing, which requires a structured process to ensure that learning objectives are met and that participants gain actionable insights. Such an approach could also be seen as a failure to uphold professional responsibilities to provide a high-quality educational experience that contributes to improved healthcare outcomes. A professional reasoning process for similar situations involves first identifying the learning objectives of the simulation. Then, selecting a debriefing model that best facilitates the achievement of those objectives, considering the experience level and psychological safety needs of the participants. This involves actively listening, asking open-ended questions, providing constructive feedback, and summarizing key learning points. It also entails a commitment to continuous professional development in debriefing techniques and an understanding of the ethical obligations to learners and the patients they will ultimately serve. Question 4. Research into the implementation of a new simulation-based curriculum for advanced practice registered nurses in the United States reveals a need to ensure alignment with national accreditation standards and patient safety guidelines. Which of the following approaches best reflects a regulatory compliant and educationally sound strategy for integrating simulation into this training program? Option A. Implement simulation exercises without a formal assessment strategy, relying on self-reported learner confidence as the primary measure of training effectiveness. Option B. Design simulation scenarios that mirror complex patient cases encountered in clinical practice, ensuring learning objectives are directly tied to the core competencies outlined by the Accreditation Commission for Education in Nursing, ASEN, and the American Association of Colleges of Nursing, ACAN, and incorporate a standardized objective structured clinical examination OSCE for performance assessment. Option C. Prioritize the use of the most technologically advanced simulation equipment available to maximize learner engagement, with learning objectives broadly defined to allow for flexibility in scenario development. Option D. Focus solely on the technical skills demonstrated during simulation, without explicit consideration for the integration of these skills into clinical decision-making or adherence to patient safety protocols. The correct answer is B. Design simulation scenarios that mirror complex patient cases encountered in clinical practice, ensuring learning objectives are directly tied to the core competencies outlined by the Accreditation Commission for Education in Nursing, ASEN, and the American Association of Colleges of Nursing, ACAN, and incorporate a standardized objective structured clinical examination, OSCE, for performance assessment. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified healthcare simulation educator, CHSE, tasked with integrating simulation into a new clinical training program. The challenge lies in ensuring that the simulation activities not only meet educational objectives, but also comply with the specific regulatory framework governing healthcare education and training within the United States. CHSE must navigate the nuances of accreditation standards, institutional policies, and potentially state-specific regulations related to clinical competency assessment and patient safety, all while designing effective learning experiences. The pressure to demonstrate the value and efficacy of simulation adds another layer of complexity, requiring a robust and defensible approach. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based, and compliant integration of simulation. This involves aligning simulation design with established accreditation standards, e.g., those from accrediting bodies for healthcare professions or institutions, ensuring that learning objectives are clearly defined and measurable, and that the simulation activities directly contribute to the development of clinical competencies as outlined by relevant professional bodies and regulatory agencies. Furthermore, it necessitates a robust evaluation framework to assess learner performance and the effectiveness of the simulation itself, with a focus on patient safety and quality improvement, which are paramount in U.S. healthcare regulations. This approach demonstrates a commitment to professional standards, ethical practice, and regulatory adherence, ensuring that the simulation program is both educationally sound and legally defensible. Incorrect approaches analysis. One incorrect approach might involve prioritizing the novelty or perceived engagement of simulation activities over their alignment with established learning outcomes and regulatory requirements. This could lead to simulations that are entertaining but fail to adequately prepare trainees for real-world clinical scenarios or meet the competency benchmarks set by accrediting bodies. Such an approach risks non-compliance with accreditation standards that mandate specific learning objectives and demonstrable skill acquisition. Another incorrect approach could be to implement simulation without a clear evaluation strategy, or without considering how learner performance will be documented and assessed against established clinical standards. This oversight can lead to a lack of accountability and an inability to demonstrate the effectiveness of the training, potentially violating regulations that require rigorous assessment of clinical competence before trainees can progress to independent practice. A third incorrect approach might involve adopting simulation technologies or methodologies without thoroughly vetting their alignment with institutional policies or national guidelines on patient safety and data privacy. This could expose the institution to risks related to noncompliance with HIPAA or other privacy regulations, as well as ethical concerns regarding the responsible use of simulation in training. Professional reasoning. Professionals in this situation should employ a decision-making process that begins with a thorough understanding of the relevant U.S. regulatory landscape, including accreditation standards for the specific healthcare profession, institutional policies, and any applicable state or federal laws. They should then clearly define the learning objectives and desired clinical competencies, ensuring these are aligned with professional practice guidelines. The design of simulation activities should be a direct response to these objectives, with a built-in, robust evaluation plan that measures performance against established benchmarks. Finally, ongoing review and adaptation based on learner feedback, performance data, and evolving regulatory requirements are crucial for maintaining a compliant and effective simulation program. Question 5. Examination of the data shows that a newly developed interprofessional simulation program involving nursing, medical, and allied health students is experiencing challenges with participant engagement and perceived relevance across all disciplines. The simulation scenarios, while clinically sound, appear to be more directly applicable to the core competencies of the nursing students. What is the most appropriate strategy to address this implementation challenge and enhance the effectiveness of the interprofessional simulation? Option A. Conduct a comprehensive review of the existing simulation equipment and technology to ensure it meets the highest technical standards, assuming that any engagement issues stem from technological limitations rather than content relevance. Option B. Develop supplementary didactic materials that explain the relevance of the current simulation scenarios to the medical and allied health professions, without altering the simulation content itself. Option C. Convene a working group comprising faculty and senior learners from each participating discipline to collaboratively revise and co-design future simulation scenarios, ensuring they address the specific learning objectives and scopes of practice for nursing, medical, and allied health professions, and pilot test these revised scenarios with diverse groups. Option D. Increase the frequency of the simulation sessions for all disciplines, believing that repeated exposure to the current scenarios will eventually lead to greater understanding and engagement across all professional groups. The correct answer is C. Convene a working group comprising faculty and senior learners from each participating discipline to collaboratively revise and co-design future simulation scenarios, ensuring they address the specific learning objectives and scopes of practice for nursing, medical, and allied health professions, and pilot test these revised scenarios with diverse groups. Explanation. This scenario presents a common challenge in implementing interprofessional simulation education, ensuring equitable learning experiences and meaningful participation across diverse professional backgrounds. The difficulty lies in designing a simulation that respects the unique scopes of practice, knowledge bases, and communication styles of each profession involved, while fostering a shared understanding and collaborative approach to patient care. Careful judgment is required to balance the need for specialized learning with the overarching goal of interprofessional teamwork. The correct approach represents best professional practice because it prioritizes a learner-centered design that actively involves representatives from all participating professions in the development process. This collaborative design ensures that the simulation scenarios are relevant, realistic, and address the specific learning objectives for each discipline, while also promoting the development of essential interprofessional competencies. Adherence to established educational best practices in simulation, such as those outlined by professional bodies for healthcare educators, mandates a focus on learner engagement and the creation of authentic learning environments. This approach aligns with ethical principles of fairness and inclusivity in education, ensuring that all learners have the opportunity to benefit from the simulation experience. An incorrect approach that focuses solely on the needs of the most represented profession risks marginalizing other participants, leading to disengagement and a failure to achieve interprofessional learning objectives. This could be seen as a failure to uphold the ethical obligation to provide equitable educational opportunities. Another incorrect approach that uses generic scenarios without tailoring them to specific interprofessional contexts fails to acknowledge the unique contributions and perspectives of each profession, undermining the core purpose of interprofessional education and potentially leading to a superficial understanding of collaboration. This demonstrates a lack of professional rigor in simulation design. A third incorrect approach that neglects to incorporate feedback from all participating groups after the simulation risks perpetuating design flaws and failing to improve future interprofessional learning experiences. This represents a failure in the professional responsibility to engage in continuous quality improvement and evidence-based practice in simulation education. Professional decision-making in such situations should involve a systematic process of needs assessment, collaborative design, pilot testing, and iterative refinement. This process should actively seek input from all stakeholders, including learners, faculty from different disciplines, and simulation technicians, to ensure the simulation is effective, relevant, and ethically sound. Prioritizing learner experience and the achievement of interprofessional competencies should guide all design and implementation decisions. Question 6. The monitoring system demonstrates a significant increase in the number of automated alerts triggered during the simulated scenario compared to previous iterations. Which of the following approaches best assesses the overall effectiveness of this simulation in improving participant competence and patient safety? Option A. Focusing solely on participant feedback regarding their perceived workload during the simulation, as increased alerts may have contributed to higher stress levels. Option B. Reporting the increase in automated alerts as a direct indicator of improved participant vigilance and a more effective simulation design, without further investigation. Option C. Correlating the increase in automated alerts with observed instances of critical decision-making errors during the simulation and analyzing debriefing notes for discussions related to alert management and team communication. Option D. Comparing the raw number of automated alerts to industry benchmarks for similar simulations, assuming a higher number indicates a more challenging and therefore more effective learning experience. The correct answer is C. Correlating the increase in automated alerts with observed instances of critical decision-making errors during the simulation and analyzing debriefing notes for discussions related to alert management and team communication. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified healthcare simulation educator to interpret complex data from a monitoring system to assess the effectiveness of a simulation. The challenge lies in moving beyond simply reporting data to understanding what that data signifies in terms of learning outcomes and the overall impact of the simulation on healthcare professionals' practice. The educator must critically evaluate the data's relevance to the simulation's objectives and the stakeholders' expectations, ensuring that the assessment is robust, evidence-based, and aligned with professional standards for simulation practice. The pressure to demonstrate value and impact on patient care adds another layer of complexity. Correct approach analysis. The correct approach involves triangulating data from the monitoring system with direct observations of participant performance, post-simulation debriefing feedback, and pre- and post-simulation knowledge or skills assessments. This multifaceted approach aligns with best professional practices in healthcare simulation assessment, as outlined by organizations like the Society for Simulation in Healthcare, SSH, in their standards and guidelines. By integrating various data sources, the educator can gain a comprehensive understanding of simulation effectiveness, validating findings, and providing a more holistic picture of learning and its transfer to practice. This method ensures that the assessment is not solely reliant on potentially superficial metrics from a monitoring system, but is grounded in observable behaviors and self-reported learning, thereby meeting ethical obligations to provide accurate and meaningful feedback to participants and stakeholders. Incorrect approaches analysis, relying solely on the quantitative metrics generated by the monitoring system, such as time to complete a task or number of errors logged, represents a significant regulatory and ethical failure. This approach is insufficient because it overlooks the qualitative aspects of learning, such as critical thinking, communication, and teamwork, which are often not captured by automated systems. It fails to meet the professional standard of comprehensive assessment and could lead to a misrepresentation of simulation effectiveness, potentially impacting future training design and resource allocation. Furthermore, it neglects the ethical imperative to thoroughly evaluate learning and its impact on patient safety. Focusing exclusively on participant satisfaction surveys without correlating them to performance data is another regulatory and ethical failure. While satisfaction is important, it does not directly measure learning or the effectiveness of the simulation in improving skills or knowledge. This approach can lead to a skewed perception of success, where participants feel good about the experience but have not demonstrably improved their competence. This falls short of the professional responsibility to ensure that simulations contribute to tangible improvements in healthcare practice and patient outcomes, potentially violating guidelines that emphasize evidence-based evaluation. Using only anecdotal feedback from instructors during debriefing sessions, without systematic data collection or correlation with other assessment methods, is also professionally unacceptable. While instructor insights are valuable, anecdotal evidence is subjective and prone to bias. Without a structured approach to collecting and analyzing this feedback, it cannot reliably inform the assessment of simulation effectiveness. This failure to employ systematic evaluation methods contravenes professional standards that require objective and reliable data for assessing educational interventions, potentially leading to inaccurate conclusions about the simulation's impact. Professional reasoning. Professionals should adopt a systematic and multimodal approach to assessing simulation effectiveness. This involves clearly defining learning objectives and then selecting assessment methods that directly measure the achievement of those objectives. The process should involve collecting both quantitative and qualitative data from multiple sources, including direct observation, validated assessment tools, and participant feedback, and then triangulating this data to draw robust conclusions. Professionals must be able to critically appraise the limitations of each data source and integrate findings to provide a comprehensive and accurate evaluation. This decision-making process is guided by professional standards, ethical principles of accountability and integrity, and the ultimate goal of improving healthcare quality and patient safety. Question 7. To address the challenge of creating a healthcare simulation scenario that is both educationally effective and ethically sound, which approach to scenario development and script writing best aligns with professional best practices for certified healthcare simulation educators? Option A. Develop a scenario based on a dramatic or rare clinical event, focusing on the technical fidelity of the simulation equipment to create a highly realistic and memorable experience for learners, irrespective of specific learning objectives. Option B. Prioritize the creation of a highly detailed script that dictates every learner action and simulationist response, ensuring absolute control over the scenario's progression and outcomes to guarantee achievement of learning objectives. Option C. Rely heavily on the simulationist's improvisational skills to create a dynamic and unpredictable scenario, with minimal pre-scripting, to foster spontaneous problem-solving and critical thinking in learners. Option D. Design a scenario with a clear set of learning objectives, a well-defined patient presentation and expected progression, and a flexible script that guides the simulationist in portraying the patient and managing emergent events, allowing for learner-driven actions. The correct answer is B. Prioritize the creation of a highly detailed script that dictates every learner action and simulationist response, ensuring absolute control over the scenario's progression and outcomes to guarantee achievement of learning objectives. Explanation. Scenario analysis. Developing realistic and effective healthcare simulation scenarios requires a delicate balance between fidelity and feasibility. The challenge lies in creating a scenario that accurately reflects a complex clinical situation, engages learners, and facilitates the achievement of specific learning objectives, all while remaining within the practical constraints of available resources, time, and simulation technology. Overly complex scenarios can overwhelm learners and obscure learning objectives, while overly simplistic ones may fail to provide adequate challenge or transferability to real-world practice. A professional challenge is to anticipate potential learner actions, design for emergent situations, and ensure the scenario promotes critical thinking and safe decision-making without introducing artificial limitations that hinder learning. Correct approach analysis. The correct approach involves a systematic, iterative process that prioritizes alignment with learning objectives and learner needs. This includes thorough needs assessment, clear objective setting, and a detailed blueprint that outlines the patient's condition, expected progression, and potential interventions. Scripting should be detailed enough to guide the simulationist in portraying the patient and managing the scenario's progression, but flexible enough to allow for learner-driven actions and emergent events. This approach ensures that the scenario is not only realistic, but also educationally sound, ethically responsible by not exposing learners to unsafe or unrealistic situations, and compliant with best practices in simulation design, which emphasize learner-centered experiences and objective achievement. Incorrect approach is analysis. An approach that focuses solely on replicating a dramatic or rare clinical event without considering the learning objectives or the learner's current skill level is ethically problematic. It risks creating a scenario that is either too advanced, leading to learner frustration and potential harm if they attempt interventions they are not prepared for, or irrelevant to their actual practice needs. This fails to uphold the educator's responsibility to provide appropriate and beneficial learning experiences. Another incorrect approach is to develop a scenario with minimal scripting and no clear progression, relying entirely on the simulationist's improvisation. While improvisation can be valuable, a lack of foundational structure can lead to a chaotic and unfocused learning experience. This can result in missed learning opportunities and a failure to meet established learning objectives, potentially violating ethical obligations to provide structured and effective education. Furthermore, it may not adequately prepare learners for the structured nature of real-world clinical decision-making. An approach that prioritizes the use of the most advanced simulation technology available, regardless of its relevance to the learning objectives or the scenario's core educational purpose, is also flawed. This can lead to a technically impressive but educationally superficial experience. Ethical failure lies in misallocating resources and potentially distracting learners from the essential clinical reasoning and teamwork skills the scenario is intended to develop. The focus should always be on the learning outcomes, not the technology itself. Professional reasoning. Professionals should employ a structured scenario development framework that begins with a clear understanding of the target audience and their learning needs. This involves defining specific, measurable, achievable, relevant, and time-bound, SMART learning objectives. The scenario design should then logically flow from these objectives, incorporating elements of realism, challenge, and opportunities for feedback. A robust script serves as a guide for the simulationist, ensuring consistency and fidelity while allowing for learner agency. Regular review and piloting of scenarios with subject matter experts and potential learners are crucial for refinement and validation, ensuring the educational integrity and ethical delivery of the simulation experience. Question 8. Analysis of the process for optimizing realism and fidelity in healthcare simulation design. What is the most effective approach for a certified healthcare simulation educator to determine the appropriate level of fidelity for a given learning objective and clinical scenario? Option A. Prioritizing the use of the most advanced and expensive simulation technology available to maximize the perceived realism, even if it exceeds the requirements of the learning objectives. Option B. Relying on the personal experience and intuition of the simulation educator to select fidelity elements that feel most realistic, without formal objective assessment. Option C. A systematic evaluation of learning objectives and clinical context to identify critical elements requiring high fidelity, balancing this with resource availability and potential learner distraction. Option D. Replicating every possible detail of the real clinical environment to ensure the simulation is as indistinguishable from reality as possible, regardless of its direct impact on learning objectives. The correct answer is C. A systematic evaluation of learning objectives and clinical context to identify critical elements requiring high fidelity, balancing this with resource availability and potential learner distraction. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare simulation education, balancing the pursuit of realism with practical constraints and the specific learning objectives. The professional challenge lies in making informed decisions about fidelity levels that maximize learning without becoming a distraction or an insurmountable barrier for learners. It requires a deep understanding of simulation design principles, adult learning theory, and the specific context of the healthcare environment being simulated. The educator must critically evaluate how different levels of fidelity impact learner engagement, skill acquisition, and the achievement of stated learning outcomes, all while adhering to professional standards and ethical considerations within the healthcare simulation field. Correct approach analysis. The correct approach prioritizes a systematic, objective-driven method for determining fidelity. This involves a thorough analysis of the learning objectives and the specific clinical scenario. The educator must identify the critical elements of the scenario that necessitate a high degree of realism to ensure learners can practice and demonstrate the required competencies effectively. This approach aligns with best practices in simulation design, which emphasize that fidelity should serve the learning objectives, not be an end in itself. By focusing on the why behind each fidelity choice, the educator ensures that resources are allocated efficiently and that the simulation experience is purposeful and impactful. This aligns with the ethical responsibility to provide high-quality, effective learning experiences for healthcare professionals. Incorrect approaches analysis. One incorrect approach focuses solely on replicating every minute detail of a real clinical environment, regardless of its impact on learning. This can lead to an overly complex or distracting simulation, where learners become bogged down in the minutiae rather than focusing on the core skills and decision-making processes. This approach fails to optimize the learning experience and can be a poor use of resources, potentially violating the ethical principle of providing value and effectiveness in education. Another incorrect approach prioritizes cost-effectiveness and ease of implementation above all else, leading to a simulation with significantly reduced fidelity. While resource management is important, sacrificing essential elements of realism that are critical for achieving learning objectives can render the simulation ineffective. This can lead to a disconnect between the simulated experience and real-world practice, potentially hindering the development of crucial competencies and failing to adequately prepare learners for clinical situations. This approach may also raise ethical concerns regarding the adequacy of the training provided. A third incorrect approach relies on anecdotal evidence or personal preference for fidelity levels without a structured evaluation. This subjective method lacks the rigor necessary for effective simulation design and can lead to inconsistent or suboptimal learning experiences. It fails to demonstrate a commitment to evidence-based practice in simulation education and may not meet the standards expected of a certified healthcare simulation educator. Professional reasoning. Professionals should adopt a systematic, objective-driven approach to fidelity decisions. This involves 1. Clearly defining learning objectives. 2. Analyzing the clinical scenario to identify critical elements requiring fidelity. 3. Evaluating the impact of different fidelity levels on learner performance and achievement of objectives. 4. Considering resource constraints and feasibility. 5. Iteratively refining the simulation design based on feedback and evaluation. This process ensures that fidelity choices are purposeful, effective, and ethically sound, maximizing the educational value of the simulation. Question 9. The efficiency study reveals that simulation-based training sessions are achieving their primary learning objectives, but a significant portion of participants report feeling demotivated and less confident in their abilities following the debriefing sessions. As a certified healthcare simulation educator, which approach to facilitating the debriefing process would best address this finding while upholding professional standards? Option A. Implement a structured debriefing model that encourages learners to reflect on their actions, identify their own learning points, and collaboratively problem-solve challenges encountered during the simulation, while ensuring feedback is constructive and delivered in a supportive manner. Option B. Focus the debriefing primarily on identifying all performance errors and deviations from protocol, providing direct corrections and detailed explanations of what should have been done. To ensure all mistakes are clearly understood, Option C. Take a directive approach, leading the discussion by providing all the correct answers and guiding learners through a step-by-step review of the simulation scenario, ensuring no ambiguity in expected performance. Option D. Minimize critical feedback during debriefing to maintain a positive and encouraging atmosphere, focusing instead on the successful aspects of the simulation and offering general encouragement. The correct answer is A. Implement a structured debriefing model that encourages learners to reflect on their actions, identify their own learning points, and collaboratively problem-solve challenges encountered during the simulation, while ensuring feedback is constructive and delivered in a supportive manner. Explanation. This scenario is professionally challenging because it requires the Certified Healthcare Simulation Educator, CHSE, to balance the immediate need for feedback with the ethical imperative of maintaining a safe and supportive learning environment. The CHSE must consider the potential impact of their debriefing approach on the learner's confidence, future performance, and adherence to professional standards. Careful judgment is required to ensure that feedback is constructive, evidence-based, and delivered in a manner that promotes learning without causing undue distress or compromising patient safety principles, which are implicitly governed by healthcare professional standards and regulatory bodies overseeing healthcare practice. The correct approach represents best professional practice because it prioritizes a structured, learner-centered debriefing methodology that aligns with established principles of adult learning and simulation-based education. This approach focuses on facilitating self-reflection and critical thinking, allowing learners to identify their own performance gaps and develop strategies for improvement. By using open-ended questions and encouraging peer feedback within a safe space, the CHSE fosters a collaborative learning environment. This aligns with the ethical obligation to promote professional development and competence, ultimately contributing to improved patient care. The CHSE role is to guide the learning process, not to dictate outcomes, ensuring that the debriefing is a valuable educational experience. An incorrect approach that focuses solely on identifying errors without exploring the underlying reasons or contributing factors fails to promote deep learning. This can lead to defensiveness and a reluctance to engage in future simulation activities. Ethically, this approach neglects the CHSE responsibility to foster a growth mindset and can undermine the learner's confidence, potentially impacting their willingness to admit mistakes in real clinical settings. Another incorrect approach that involves the CHSE providing all the answers and directing the discussion rigidly overlooks the power of learner-driven discovery. This can create a passive learning experience where learners are less likely to internalize the lessons learned. From a professional standpoint, this approach fails to develop the learner's critical thinking and problem-solving skills, which are essential for competent healthcare practice. It also misses an opportunity to assess the learner's understanding and application of knowledge in a dynamic way. A third incorrect approach that avoids addressing critical performance issues due to a desire to maintain a positive atmosphere is ethically problematic. While a supportive environment is crucial, failing to address significant deviations from best practice or patient safety concerns is a dereliction of the CHSE duty to ensure that learners are prepared for safe and effective patient care. This can have serious implications for patient well-being and contravenes the implicit regulatory expectation that healthcare professionals are trained to a high standard. The professional decision-making process for similar situations should involve a pre-simulation assessment of learning objectives, an understanding of the simulation's fidelity and potential learning points, and a flexible debriefing plan. The CHSE should be prepared to adapt their approach based on the learner's performance and engagement. Key considerations include establishing clear ground rules for the debriefing, using a structured debriefing model, e.g., ask, tell, ask, pearls, actively listening to learners, providing specific and actionable feedback, and encouraging self-correction and peer learning. The ultimate goal is to create an environment where learners feel safe to explore their performance, learn from their experiences, and develop the skills necessary for safe and effective healthcare delivery. Question 10. The risk matrix shows a moderate risk of learner dissatisfaction and a low risk of equipment malfunction associated with a particular simulation modality. The learning objectives for the upcoming training session focus on developing advanced teamwork and communication skills in a high-stress emergency scenario. Given these factors, which simulation modality selection best aligns with the principles of effective healthcare simulation education? Option A simple task trainer for practicing a specific procedural skill. Option B, a tabletop exercise using paper-based scenarios and discussion. Option C, a standardized patient program with pre-scripted roles and scenarios. Option D, a high-fidelity mannequin with integrated audio-visual recording capabilities for debriefing. The correct answer is D, a high-fidelity mannequin with integrated audio-visual recording capabilities for debriefing. Explanation: scenario analysis. This scenario presents a common challenge in healthcare simulation education, balancing the desire for realistic training with resource constraints and the need to adhere to established educational standards and regulatory expectations. The challenge lies in selecting simulation modalities that effectively meet learning objectives while remaining compliant with the Certified Healthcare Simulation Educator (CHSE) framework, which implicitly guides best practices in simulation design and implementation. The risk matrix, a tool for assessing potential negative outcomes, highlights the need for a deliberate and evidence-informed approach to modality selection, rather than a purely cost-driven or convenience-based decision. Correct approach analysis. The correct approach prioritizes the alignment of simulation modality with specific learning objectives and the established competencies outlined by the CHSE framework. This means selecting a modality that provides the necessary level of fidelity to allow learners to practice the intended skills, decision-making, and teamwork in a safe and controlled environment. For instance, if the learning objective involves complex procedural skills requiring tactile feedback, and realistic physiological responses, a high-fidelity simulator would be the most appropriate choice. This approach is best professional practice because it ensures that the simulation experience is educationally sound, effective in achieving desired outcomes, and ultimately contributes to improved patient safety and quality of care, which are overarching goals in healthcare education and implicitly supported by professional certification standards. Incorrect approach is analysis. Choosing a low-fidelity modality solely due to budget constraints, without a thorough assessment of its ability to meet the learning objectives, represents a failure to uphold educational best practices. While cost-effectiveness is a consideration, it should not supersede the primary goal of effective learning. This approach risks providing an inadequate learning experience, potentially leading to skill deficits or a lack of preparedness for real-world clinical situations, which could have ethical implications related to patient safety. Opting for a virtual reality simulation without confirming its validated effectiveness for the specific learning objectives, or ensuring its technical reliability and user-friendliness for the target audience, is another professionally unacceptable approach. While VR can be a powerful tool, its efficacy is context-dependent. A poorly implemented VR simulation can lead to learner frustration, disengagement, and a failure to achieve the intended learning outcomes, thus not meeting the standards of a well-designed simulation experience. Selecting a modality based on its novelty or perceived technological advancement, rather than its pedagogical suitability, is also a flawed approach. The focus must remain on the educational value and the ability of the modality to facilitate the achievement of learning objectives, not on the technology itself. This can lead to wasted resources and an ineffective learning experience. Professional reasoning. Professionals should employ a systematic decision-making process that begins with clearly defining the learning objectives and desired outcomes. This should be followed by an analysis of the competencies to be addressed, drawing upon established frameworks like those implicitly guiding CHSE certification. Subsequently, an evaluation of available simulation modalities should be conducted, considering their fidelity, realism, cost, technical requirements, and crucially, their documented effectiveness in achieving similar learning objectives. A risk assessment, as indicated by the risk matrix, should inform the final decision, ensuring that the chosen modality minimizes potential educational risks while maximizing learning potential. Collaboration with subject matter experts and experienced simulationists is also vital in this process. Question 11. What factors determine the appropriate integration of advanced technological tools into healthcare simulation scenarios to enhance learning outcomes and operational efficiency? Option A. The availability of the latest technological innovations and the potential for the simulation center to be perceived as technologically advanced. Option B. The personal preference of the simulation educator for specific technological solutions, regardless of their pedagogical impact. Option C. The alignment of the technology with specific learning objectives, the technical feasibility and support infrastructure, and a thorough cost-effectiveness analysis. Option D. The ease with which a technology can be implemented without requiring significant training for the simulation educator or learners. Correct answer is C. The alignment of the technology with specific learning objectives, the technical feasibility and support infrastructure, and a thorough cost-effectiveness analysis. Explanation. This scenario is professionally challenging because it requires the Certified Healthcare Simulation Educator, CHSE, to balance the potential benefits of advanced technology with the practical realities of resource allocation, learner needs, and the ethical imperative to provide effective and equitable simulation-based education. The CHSE must navigate the temptation to adopt the latest technology without a clear pedagogical justification or consideration for its impact on the overall learning experience and institutional sustainability. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and learner-centered integration of technology. This aligns with the CHSE ethical responsibility to ensure that simulation activities are designed to achieve specific learning outcomes and enhance professional competence, rather than being driven by technological novelty. By conducting a thorough needs assessment, evaluating the pedagogical alignment, considering technical feasibility and support, and assessing the cost-effectiveness, the CHSE ensures that technology serves as a tool to enhance learning, not as an end in itself. This approach also implicitly considers the sustainability of the simulation program and the equitable access for all learners, which are crucial ethical considerations in healthcare education. An incorrect approach that focuses solely on the perceived prestige or novelty of a technology without a clear pedagogical rationale fails to meet the CHSE ethical obligation to provide effective education. This can lead to wasted resources, learner frustration, and a failure to achieve desired learning outcomes, potentially impacting patient safety indirectly. Another incorrect approach that neglects technical support and maintenance risks creating unreliable simulation experiences, undermining the credibility of the simulation program, and failing to uphold professional standards of quality. Furthermore, an approach that ignores cost-effectiveness and budget constraints can lead to unsustainable practices, potentially limiting future educational opportunities or requiring compromises in other essential areas of the simulation program. The professional decision-making process for similar situations should involve a structured evaluation framework. This framework should begin with clearly defined learning objectives, followed by an assessment of how specific technologies can best support the achievement of those objectives. A critical component is the evaluation of the technology's alignment with the target audience's skill level and learning preferences. Technical feasibility, including infrastructure requirements, IT support, and maintenance, must be thoroughly investigated. Finally, a comprehensive cost-benefit analysis, considering both initial investment and ongoing operational costs, should be conducted to ensure the chosen technology is a prudent and sustainable investment for the simulation program. Question 12. The performance metrics show a statistically significant improvement in critical event management and a reduction in reported near misses among staff who participated in simulation-based training compared to those who underwent traditional didactic lectures. Considering the diverse stakeholder perspectives, which approach best demonstrates the value and effectiveness of simulation-based education in this context? Option A. Emphasize the improved patient safety indicators and enhanced clinical competencies directly linked to simulation, presenting this data to clinical leadership and educational committees to advocate for continued investment and expansion of simulation programs. Option B. Highlight the positive feedback from learners regarding the engaging nature of simulation, suggesting that increased learner satisfaction is a primary indicator of successful educational interventions. Option C. Focus on the cost savings achieved by reducing the number of traditional lecture hours, arguing that simulation is a more financially efficient method of knowledge transfer. Option D. Present a collection of individual success stories and testimonials from participants, illustrating the perceived benefits of simulation without a systematic analysis of performance data. The correct answer is A. Emphasize the improved patient safety indicators and enhanced clinical competencies directly linked to simulation, presenting this data to clinical leadership and educational committees to advocate for continued investment and expansion of simulation programs. Explanation. Scenario analysis. This scenario presents a common challenge for healthcare simulation educators, demonstrating the value and effectiveness of simulation-based education, SBE, compared to traditional didactic methods. The challenge lies in translating observed performance improvements into tangible benefits that resonate with diverse stakeholders, including clinical leadership, educators, and learners. The need to justify resource allocation for simulation further amplifies this challenge, requiring a clear articulation of return on investment and alignment with educational and patient safety goals. Correct approach analysis. The correct approach focuses on a holistic evaluation that considers multiple facets of learning and performance. It acknowledges that simulation's strengths lie in its ability to foster critical thinking, teamwork, and skill acquisition in a safe environment, leading to improved patient care outcomes. By linking simulation-derived improvements to specific patient safety indicators and clinical competencies, this approach provides a compelling, evidence-based argument for its efficacy. This aligns with the ethical imperative to provide high-quality, effective education that ultimately benefits patient well-being, a core tenet in healthcare education. Furthermore, it supports the professional responsibility of simulation educators to advocate for best practices in learning and development. Incorrect approaches analysis. An approach that solely focuses on learner satisfaction surveys without correlating these to objective performance gains fails to demonstrate the educational impact of simulation. While learner engagement is important, it does not inherently prove that the learning objectives have been met or that patient care has improved. This approach risks misrepresenting the value of simulation by prioritizing subjective feedback over demonstrable outcomes, potentially leading to misallocation of resources. Ethically, it falls short of the duty to provide demonstrably effective education. An approach that prioritizes cost-effectiveness above all else, without a thorough evaluation of learning outcomes and patient safety, is also problematic. While fiscal responsibility is crucial, it should not overshadow the primary goal of improving healthcare quality and patient safety through effective education. Focusing solely on cost savings from reduced traditional methods, without proving simulation's equivalent or superior educational value, is a failure to uphold professional standards and ethical obligations to patients. An approach that relies on anecdotal evidence or isolated success stories, without systematic data collection and analysis, lacks the rigor required to justify the widespread adoption and investment in simulation. Anecdotes can be powerful, but they are not a substitute for robust evaluation. This approach fails to provide a reliable basis for decision-making and can lead to inconsistent application of simulation, undermining its potential benefits. It also fails to meet the professional standard of evidence-based practice in education. Professional reasoning. Professionals should adopt a data-driven, outcome-oriented approach. This involves defining clear learning objectives, selecting appropriate evaluation methods that measure both knowledge acquisition and skill application, and linking these outcomes to broader organizational goals, such as patient safety and quality improvement. A systematic evaluation framework, incorporating both qualitative and quantitative data, is essential for demonstrating the value of simulation and informing future educational strategies. This process requires collaboration with stakeholders to ensure alignment and buy-in. Question 13. Regulatory review indicates that a certified healthcare simulation educator is designing a high-fidelity simulation scenario involving a complex ethical dilemma with significant emotional weight. The educator is aware that such scenarios can evoke strong emotional responses in learners. What is the most appropriate approach to ensure participant well-being and maximize learning outcomes? Option A. Conduct a thorough pre-simulation assessment of potential psychological impact, establish clear communication channels regarding scenario content, and implement a structured debriefing process with psychological support mechanisms. Option B. Implement the simulation scenario with a focus on technical realism, believing that the intensity of the experience will inherently foster learning and coping skills. Option C. Proceed with the highly realistic scenario as designed, assuming learners are resilient and capable of managing emotional responses independently. Option D. Design a less emotionally charged version of the scenario to avoid any potential for participant distress, even if it reduces the fidelity and learning potential of the ethical dilemma. The correct answer is A. Conduct a thorough pre-simulation assessment of potential psychological impact, establish clear communication channels regarding scenario content, and implement a structured debriefing process with psychological support mechanisms. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare simulation education, balancing the need for realistic simulation experiences with the ethical imperative to protect participants from undue psychological distress. The educator must assess the potential impact of a highly realistic, emotionally charged scenario on learners, considering their individual coping mechanisms and the overall learning objectives. Failure to adequately assess and mitigate risks can lead to negative learning experiences, burnout, and potential harm to participants, which has implications for professional conduct and institutional responsibility. Correct approach analysis. The correct approach involves a proactive and systematic assessment of the potential psychological impact of the simulation scenario on participants. This includes pre-simulation briefing to gauge participant readiness and establish psychological safety, careful scenario design to ensure it aligns with learning objectives without being gratuitously distressing, robust post-simulation debriefing to process the experience and provide support. This approach aligns with ethical principles of beneficence, acting in the best interest of the learner, and non-maleficence, avoiding harm. It also reflects best practices in simulation pedagogy, emphasizing a learner-centered approach that prioritizes well-being alongside skill development. Regulatory frameworks in healthcare education often mandate a duty of care towards learners, requiring educators to anticipate and manage potential risks. Incorrect approach is analysis. Proceeding with a highly realistic and emotionally charged scenario without a thorough pre-simulation assessment of participant psychological readiness, and without established support mechanisms, is a significant ethical and professional failure. This approach disregards the potential for harm and fails to uphold the duty of care owed to learners. It prioritizes realism over participant well-being, which is contrary to the principles of safe and effective simulation. Implementing a simulation scenario that is known to be highly distressing for a specific learner group without providing adequate psychological support or alternative options demonstrates a lack of professional judgment and an understanding of the educator's responsibilities. This could be seen as a breach of professional conduct, potentially violating institutional policies and ethical guidelines related to participant welfare. Focusing solely on the technical fidelity of the simulation, without considering the emotional and psychological impact on participants, overlooks a critical component of effective healthcare simulation. This narrow focus can lead to simulations that are technically impressive but pedagogically unsound and potentially harmful, failing to meet the broader goals of professional development and patient safety. Professional reasoning. Professionals in healthcare simulation education should adopt a decision-making process that prioritizes a comprehensive risk-benefit analysis for every simulation design. This involves 1. Clearly defining learning objectives and ensuring the chosen scenario directly supports them. 2. Identifying potential risks, particularly psychological distress, associated with the scenario's content and realism. 3. Implementing mitigation strategies, such as pre-simulation screening, clear communication of scenario content, establishing psychological safety, and providing robust debriefing and support. 4. Continuously evaluating the effectiveness of these strategies and adapting as needed. This systematic approach ensures that simulations are both educationally valuable and ethically sound, safeguarding the well-being of participants. Question 14. The efficiency study reveals that the simulation-based training for new nurses is completed 15% faster than previous methods, but the educator is concerned about whether the speed increase has impacted the achievement of critical patient safety learning objectives. Which approach best addresses this concern? Option A. Prioritize participant feedback on the perceived ease and speed of the simulation, as high satisfaction often indicates effective training. Option B. Report the 15% time reduction as the sole success metric, as efficiency was the stated goal of the study. Option C. Focus on the cost savings achieved by the faster completion time, as this is the primary driver of the efficiency study. Option D. Evaluate the correlation between the reduced completion time and the demonstrated mastery of patient safety skills, as defined by the learning objectives. Correct answer is D. Evaluate the correlation between the reduced completion time and the demonstrated mastery of patient safety skills, as defined by the learning objectives. Explanation. This scenario is professionally challenging because it requires a simulation educator to balance the practical demands of an efficiency study with the core pedagogical principles of learning. The educator must ensure that the study's findings are valid and actionable, without compromising the integrity of the learning experience or the achievement of established learning objectives. Careful judgment is required to avoid superficial data collection that might misrepresent the true impact of simulation on learning outcomes. The correct approach represents best professional practice because it directly links the efficiency study's finding to the established learning objectives and outcomes. This ensures that the evaluation is not merely about time or resource utilization, but about whether the simulation effectively contributes to the intended learning. This aligns with the principles of evidence-based practice in healthcare education, where the impact of educational interventions must be demonstrably linked to desired learner performance and patient care improvements. Regulatory frameworks for healthcare education, while not explicitly detailed here due to the exam's specific jurisdiction, generally emphasize accountability and the demonstrable effectiveness of training programs. Focusing on the alignment between simulation activities, learning objectives, and measurable outcomes is a cornerstone of quality assurance in simulation-based education. An incorrect approach that focuses solely on the speed of simulation completion, without considering the depth of learning or the achievement of specific learning objectives, is professionally unacceptable. This fails to meet the fundamental purpose of simulation, which is to facilitate learning and skill development. It represents a superficial understanding of educational effectiveness and could lead to the implementation of less effective or even detrimental training practices. Ethically, it is a failure to provide learners with a valuable and impactful educational experience. Another incorrect approach that prioritizes the cost-effectiveness of simulation over its impact on learning objectives is also professionally unacceptable. While resource management is important, it should not supersede the primary goal of education. This approach risks devaluing the simulation experience and potentially cutting corners that negatively affect learning. It can lead to a situation where simulations are cheap but ineffective, failing to equip healthcare professionals with the necessary competencies. This is a regulatory and ethical failure as it compromises the quality of training and potentially patient safety. A third incorrect approach that focuses on participant satisfaction surveys as the sole metric of efficiency ignores the critical link between satisfaction and actual learning. While learner engagement is important, satisfaction alone does not guarantee that learning objectives have been met or that skills have been effectively transferred to practice. This approach is professionally unacceptable because it relies on a potentially biased and incomplete measure of success, failing to provide robust evidence of simulation's educational value. It is a failure to adhere to rigorous evaluation standards expected in professional education. The professional reasoning process for this situation should involve a systematic approach to evaluation. First, clearly define the learning objectives and desired outcomes for the simulation. Second, design the efficiency study to collect data that directly measures the achievement of these objectives and outcomes, alongside efficiency metrics. Third, analyze the data to determine the correlation between simulation efficiency and learning effectiveness. Finally, use these findings to inform improvements in simulation design and delivery, ensuring that efficiency gains do not come at the expense of educational quality. This iterative process of design, implementation, evaluation, and refinement is crucial for maintaining high standards in healthcare simulation education. Question 15. The risk matrix shows that providing immediate, direct, and critical feedback on all perceived errors during a healthcare simulation debriefing carries a high risk of learner demotivation and disengagement. As a certified healthcare simulation educator, which approach best balances the need for constructive feedback with fostering a safe and effective learning environment, thereby encouraging reflection and critical thinking. Option A. Offer general positive reinforcement about the learner's effort and enthusiasm without delving into specific performance details or areas for improvement. Option B. Immediately list all observed deviations from expected protocols and provide detailed critiques of each error, focusing on what was done incorrectly. Option C. Facilitate a guided self-reflection process by asking open-ended questions that prompt learners to analyze their own actions, decisions, and the rationale behind them, allowing them to identify their own learning opportunities. Option D. Focus the debriefing exclusively on the final outcome of the simulation scenario, regardless of the decision-making process or the learner's actions leading to that outcome. The correct answer is C. Facilitate a guided self-reflection process by asking open-ended questions that prompt learners to analyze their own actions, decisions, and the rationale behind them, allowing them to identify their own learning opportunities. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare simulation education, balancing the need for constructive feedback with the potential for negative impact on learner confidence and engagement. The risk matrix highlights that, while direct, blunt feedback might identify areas for improvement, it carries a high risk of demotivation, potentially hindering future learning, and even leading to disengagement from simulation activities. The educator must navigate this by fostering an environment where learners feel safe to explore their performance, make mistakes, and learn from them without undue fear of judgment. This requires a nuanced approach that prioritizes psychological safety and a growth mindset. Correct approach analysis. The correct approach emphasizes facilitating self-reflection and guided discovery. By asking open-ended questions that prompt learners to analyze their own actions and decisions, the educator empowers them to identify their own learning needs. This aligns with best practices in adult learning theory, which posits that learners are more invested in and retain information better when they are actively involved in the learning process. Ethically, this approach respects the learner's autonomy and dignity, fostering a collaborative learning relationship rather than a hierarchical one. It also indirectly supports the regulatory framework by promoting a culture of continuous improvement and patient safety, as learners who are encouraged to critically analyze their performance are more likely to identify and mitigate potential risks in real clinical settings. Incorrect approach is analysis. One incorrect approach involves immediately pointing out all perceived errors in a direct, critical manner. This fails to acknowledge the psychological impact of such feedback, potentially violating ethical principles of beneficence and non-maleficence by causing unnecessary distress and hindering learning. It also bypasses the opportunity for the learner to develop their own critical thinking skills, which is a core objective of simulation. Another incorrect approach is to offer overly generalized praise without specific examples or opportunities for self-assessment. While this may boost immediate confidence, it fails to identify specific areas for improvement, thus failing to meet the educational objectives of the simulation. This approach can lead to a false sense of competence and does not contribute to the development of critical thinking or the identification of risks, potentially impacting patient safety in the long run. A third incorrect approach is to focus solely on the outcome of the scenario, regardless of the process or decision-making. This overlooks the learning opportunities inherent in the learner's thought process and actions. It can discourage learners from taking calculated risks or exploring alternative strategies, as they may fear negative judgment based solely on an outcome that could be influenced by factors beyond their control. This is ethically problematic as it does not fully support the learner's development and can create a punitive learning environment. Professional reasoning. Professionals should employ a reflective practice model, beginning with pre-briefing that sets clear expectations and establishes psychological safety. During the debriefing, the educator should act as a facilitator, using structured questioning techniques, e.g., asking what went well and what would you do differently, to guide the learner's self-assessment. The educator's role is to support the learner's discovery of their own learning needs, offering expert guidance and feedback only after the learner has had the opportunity to reflect. This iterative process of observation, reflection, and guided feedback is crucial for developing critical thinking and ensuring that learning is meaningful and transferable to clinical practice. Question 16. Quality control measures reveal that a simulation facilitator, when debriefing a team, consistently provides more detailed and encouraging feedback to participants they perceive as having strong prior experience, while offering more concise and directive feedback to those they believe are less experienced. This approach is applied across all simulation scenarios, regardless of the specific learning objectives. What is the most appropriate facilitator role and responsibility in this situation? Option A. The facilitator should ensure all participants receive feedback tailored to their individual learning needs and performance against established objectives, fostering an equitable learning environment and promoting objective assessment. Option B. The facilitator should prioritize providing extensive guidance to participants perceived as less experienced to quickly bring them up to the expected standard, ensuring team efficiency. Option C. The facilitator should focus primarily on the technical execution of skills during the simulation, as this is the most objective measure of performance for all participants. Option D. The facilitator should allow their assessment of prior experience to guide the depth and style of feedback, as this reflects a realistic approach to team dynamics and individual development. The correct answer is A. The facilitator should ensure all participants receive feedback tailored to their individual learning needs and performance against established objectives, fostering an equitable learning environment and promoting objective assessment. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare simulation education, where a facilitator's personal biases or assumptions can inadvertently influence the learning environment and the assessment of participants. The challenge lies in ensuring objective and equitable facilitation that supports all learners, regardless of their prior experience or perceived aptitude, aligning with the core principles of adult learning and professional development in healthcare. Correct approach analysis. The correct approach emphasizes the facilitator's responsibility to create a neutral and supportive learning environment. This involves actively managing the simulation to ensure all participants have equitable opportunities to engage, contribute, and learn. It requires the facilitator to set clear expectations, provide constructive feedback based on observable behaviors and established learning objectives, and to debrief in a manner that encourages self-reflection and peer learning without judgment. This aligns with the ethical imperative to provide fair and unbiased education, as well as the professional standards expected of simulation educators to foster a safe and effective learning space. The focus on objective observation and feedback directly supports the principles of competency-based education and professional accountability within healthcare. Incorrect approaches analysis. One incorrect approach involves the facilitator allowing their personal perception of a participant's prior knowledge to dictate the level of engagement or the nature of feedback provided. This can lead to a situation where some participants are over-supported and others are under-challenged, creating an inequitable learning experience. This violates the principle of providing all learners with the opportunity to meet learning objectives and can be seen as a failure to uphold professional standards of impartiality. It may also inadvertently reinforce existing biases within the healthcare team. Another incorrect approach is for the facilitator to focus solely on the technical performance of participants during the simulation, neglecting the crucial aspects of teamwork, communication, and decision-making. While technical skills are important, effective healthcare delivery relies on a holistic approach. Failing to address these broader competencies means the simulation is not fully achieving its educational potential, and the facilitator is not fulfilling their responsibility to develop well-rounded healthcare professionals. This can lead to a failure to meet the broader educational goals and potentially impact patient safety if these non-technical skills are not adequately developed. A third incorrect approach involves the facilitator intervening excessively during the simulation to guide participants towards a specific outcome, rather than allowing them to problem solve and learn from their own decisions. While guidance is part of facilitation, over-intervention can stifle critical thinking and reduce the learning value of the experience. It shifts the focus from participant-led learning to facilitator-directed performance, which is not conducive to developing independent and adaptable healthcare professionals. This can be seen as a failure to adhere to best practices in simulation pedagogy, which advocate for learner-centered experiences. Professional reasoning. Professionals should approach simulation facilitation with a commitment to objectivity, equity, and learner development. This involves a conscious effort to set aside personal biases, clearly define learning objectives, and observe participant performance against these objectives. The debriefing process should be structured to encourage reflection, provide specific and actionable feedback, and foster a collaborative learning environment. When faced with situations where personal perceptions might influence judgment, professionals should rely on established simulation frameworks and debriefing models, e.g., advocacy inquiry, PEARLs, to ensure a structured and unbiased approach. Regular self-reflection and seeking feedback on one's own facilitation practices are also critical for continuous professional development. Question 17. Strategic planning requires a thorough understanding of the intended impact of a healthcare simulation program. A simulation department is tasked with developing a new program to enhance patient safety. Which of the following approaches to needs assessment would best align with best professional practice and regulatory expectations for evidence-based program development? Option A. Implementing the latest simulation technologies that are currently trending in the field, assuming these will automatically address any potential patient safety concerns. Option B. Prioritizing simulation topics based on the ease of scenario development and the availability of existing simulation equipment, without extensive consultation. Option C. Relying on the simulation educator's personal experience and intuition to design scenarios that they believe will be beneficial for patient safety. Option D. Conducting a comprehensive review of patient safety incident reports, interviewing frontline staff about their perceived challenges, and surveying key clinical leaders to identify areas where simulation can provide targeted training and skill development. The correct answer is D. Conducting a comprehensive review of patient safety incident reports, interviewing frontline staff about their perceived challenges, and surveying key clinical leaders to identify areas where simulation can provide targeted training and skill development. Explanation. This scenario presents a common challenge in healthcare simulation program development, ensuring that the simulation program effectively addresses identified needs within the healthcare setting. The professional challenge lies in moving beyond a superficial understanding of needs to a data-driven, stakeholder-informed approach that aligns with the program's objectives and resource constraints. Careful judgment is required to prioritize interventions and ensure that the simulation program delivers tangible benefits. The correct approach represents best professional practice because it systematically identifies and prioritizes simulation needs based on evidence and stakeholder input. This aligns with the principles of effective program planning and resource allocation, ensuring that simulation efforts are targeted, relevant, and impactful. By involving key stakeholders, the process ensures buy-in and facilitates the integration of simulation into existing workflows and educational strategies. This approach is ethically sound as it promotes responsible use of resources and aims to improve patient care and professional development through targeted interventions. An incorrect approach that relies solely on anecdotal evidence or the loudest voices fails to establish a robust foundation for the simulation program. This can lead to misallocation of resources, development of irrelevant scenarios, and ultimately, a failure to meet the intended learning objectives or address critical healthcare gaps. Ethically, this approach can be seen as negligent, as it does not demonstrate due diligence in understanding and responding to genuine needs. Another incorrect approach that focuses exclusively on readily available technology, without a clear understanding of the learning objectives or identified needs, is also professionally unacceptable. This prioritizes tools over purpose, potentially leading to expensive and underutilized simulation equipment. It violates the principle of effective resource management and fails to demonstrate a commitment to evidence-based practice in simulation design. A further incorrect approach that bypasses essential stakeholder consultation and focuses solely on the simulation educator's personal expertise, while valuable, is insufficient. This can lead to a disconnect between the simulation program and the actual needs and priorities of the healthcare organization. It risks creating a program that is technically sound, but lacks relevance and buy-in from those who will be impacted by it, failing to foster a collaborative and integrated approach to simulation. The professional decision-making process for similar situations should involve a structured needs assessment framework. This typically includes 1. Identifying the target audience and their current knowledge/skills. 2. Defining desired outcomes and performance standards. 3. Gathering data through surveys, interviews, focus groups, and performance reviews. 4. Analyzing the data to identify gaps and priorities. 5. Involving stakeholders in validating the identified needs. And 6. Translating these needs into specific, measurable, achievable, relevant, and time-bound, smart simulation objectives. Question 18. Benchmark analysis indicates that simulation management software can significantly enhance operational efficiency and data collection for healthcare simulation centers. A certified healthcare simulation educator, CHSE, is tasked with selecting a new platform for their institution. Considering the principles of process optimization, which of the following approaches best aligns with professional best practices for selecting and implementing such a system? Option A. Select the software with the most advanced features and highest user ratings from online reviews, assuming it will automatically improve all aspects of simulation management. Option B. Initiate a pilot program with a diverse group of simulation users to evaluate the software's functionality, usability, and impact on educational outcomes before full institutional adoption, ensuring comprehensive training is developed concurrently. Option C. Prioritize the software that offers the lowest upfront cost, even if it requires significant customization or lacks essential features identified in initial discussions. Option D. Implement the software immediately across all simulation activities to maximize the return on investment, with training provided on an as-needed basis to faculty. The correct answer is B. Initiate a pilot program with a diverse group of simulation users to evaluate the software's functionality, usability, and impact on educational outcomes before full institutional adoption, ensuring comprehensive training is developed concurrently. Explanation. This scenario is professionally challenging because the Certified Healthcare Simulation Educator, CHSE, must balance the desire for technological advancement and efficiency with the practical realities of budget constraints, staff training, and the potential for disruption to existing functional simulation programs. The CHSE role extends beyond simply selecting software. It involves strategic planning, stakeholder management, and ensuring that technology adoption aligns with educational objectives and institutional policies, all while adhering to relevant professional standards and ethical considerations. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation process that considers the holistic impact of the simulation management software. This includes a thorough needs assessment, pilot testing, and comprehensive training, ensuring that the chosen platform not only meets technical requirements, but also enhances learning outcomes and is effectively integrated into the simulation center's operations. This aligns with the CHSE responsibility to promote high-quality simulation experiences and maintain the integrity of educational programs, as often implicitly or explicitly guided by professional standards that emphasize learner-centered approaches and continuous quality improvement. An incorrect approach that focuses solely on acquiring the most feature-rich or cutting-edge software without adequate needs assessment or pilot testing fails to demonstrate due diligence. This could lead to significant financial waste, underutilization of the software, and potential disruption to ongoing educational activities, which could be seen as a failure to manage resources responsibly and effectively, potentially contravening institutional policies on procurement and technology adoption. Another incorrect approach that neglects comprehensive staff training and support for the new software introduces a significant risk of user error and underutilization. This can undermine the intended benefits of the technology, leading to frustration among educators and learners, and ultimately failing to optimize the simulation experience. Ethically, this could be viewed as a failure to adequately support the professional development of colleagues and ensure equitable access to effective simulation tools. A third incorrect approach that bypasses stakeholder consultation, particularly with faculty and IT departments, risks implementing a solution that is incompatible with existing infrastructure or does not meet the diverse needs of the simulation users. This can create significant operational challenges and resistance to adoption, demonstrating a lack of collaborative leadership and potentially violating institutional guidelines for technology implementation that require cross-departmental input. The professional decision-making process for similar situations should involve a structured approach. 1. Clearly define the educational and operational needs that the simulation management software is intended to address. 2. Conduct thorough market research to identify potential solutions that align with these needs. 3. Engage key stakeholders, faculty, IT, administration early in the process to gather input and ensure buy-in. 4. Develop clear evaluation criteria, including functionality, usability, technical support, cost-effectiveness, and alignment with institutional goals. 5. Implement a pilot testing phase with a representative group of users to assess real-world performance and gather feedback. 6. Develop a comprehensive implementation and training plan that addresses the needs of all users. 7. Establish metrics for evaluating the success of the new software post-implementation. Question 19. The evaluation methodology shows a simulated patient presenting with acute respiratory distress during a high-fidelity simulation exercise. The facilitator, intending to assess the participant's management of airway compromise, proceeds with simulated intubation without first explicitly asking the simulated patient for consent to perform the procedure, stating, "We need to secure your airway." Following the simulation, the facilitator discusses the participant's performance, including the simulated patient's physiological responses, with another instructor who was not involved in the debriefing, in a public area of the simulation center. Which approach best upholds the ethical and regulatory requirements for informed consent and confidentiality in healthcare simulation? Option A. Proceed with simulated interventions as deemed necessary by the facilitator to assess participant competency, and discuss simulation outcomes with any colleague who might offer valuable feedback, regardless of their direct involvement. Option B. Assume implied consent for all simulated procedures based on the participant's agreement to engage in the simulation exercise, and consider any information shared about the simulation as de-identified and therefore not subject to confidentiality concerns. Option C. Obtain explicit verbal consent from the simulated patient for all simulated interventions, clearly explaining the purpose and nature of the procedure, and ensure all discussions about the simulation and its outcomes are confined to private, secure settings with only relevant personnel. Option D. Focus solely on the technical skills demonstrated during the simulation, as ethical considerations like informed consent and confidentiality are secondary in a simulated environment and do not carry the same weight as in clinical practice. The correct answer is C. Obtain explicit verbal consent from the simulated patient for all simulated interventions, clearly explaining the purpose and nature of the procedure, and ensure all discussions about the simulation and its outcomes are confined to private, secure settings with only relevant personnel. Explanation. The evaluation methodology shows a simulation scenario designed to assess a healthcare professional's ability to manage a patient experiencing a sudden, severe allergic reaction. This scenario is professionally challenging because it requires the simulated participant to rapidly assess the situation, recall and apply emergency protocols, and communicate effectively under pressure, all while maintaining patient confidentiality and ensuring informed consent for the simulated intervention. The ethical imperative to protect patient privacy, even in a simulated environment, is paramount. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from the simulated patient regarding the nature of the simulation, the potential interventions, and the handling of any data collected. This aligns with the fundamental ethical principles of autonomy and beneficence, ensuring the simulated participant understands and agrees to the simulated experience. Furthermore, it upholds the principle of confidentiality by ensuring that any data generated during the simulation, even if anonymized, is handled securely and used only for the stated educational purpose, in accordance with relevant healthcare privacy regulations. An incorrect approach that fails to obtain informed consent before initiating simulated interventions is ethically unacceptable. This violates the principle of autonomy, as the simulated patient has not agreed to the simulated procedures. It also creates a false precedent for real-world practice, where informed consent is a legal and ethical requirement. Another incorrect approach that involves discussing the simulated patient's condition or response with uninvolved colleagues outside the debriefing session, even if the patient is simulated, breaches the spirit of confidentiality. While the patient is not real, the simulation is designed to mirror real-world clinical encounters, and establishing habits of discussing patient information inappropriately can lead to actual breaches of confidentiality in practice. This undermines trust and professional integrity. Professional decision-making in such situations requires a systematic approach. First, clearly define the learning objectives of the simulation. Second, design the simulation to ethically mirror real-world clinical practice, including obtaining informed consent from the simulated patient for all interventions. Third, establish clear protocols for data handling and confidentiality, ensuring that all information is protected. Fourth, conduct a thorough debriefing that addresses both technical skills and ethical considerations, reinforcing the importance of informed consent and confidentiality. Finally, regularly review and update simulation protocols to ensure ongoing compliance with ethical standards and regulatory requirements. Question 20. Market research demonstrates a growing interest in highly immersive and technologically advanced simulation experiences for healthcare educators. A simulation developer proposes a new virtual reality scenario that features a fantastical disease with unique, never-before-seen symptoms and diagnostic challenges, designed to be highly engaging and visually spectacular. The primary goal stated by the developer is to push the boundaries of what simulation can be. Which of the following approaches best aligns with the definition and purpose of simulation in healthcare education? Option A. Create a simulation that simplifies complex clinical processes to ensure all learners can easily complete the scenario, prioritizing a high success rate over realistic challenges. Option B. Focus on a simulation that prioritizes entertainment value and cutting-edge technology, with the learning objectives being secondary to the overall user experience. Option C. Develop a simulation based on the fantastical disease, emphasizing its unique visual and interactive elements to maximize learner engagement and introduce novel problem-solving concepts. Option D. Design a simulation that accurately reflects common and critical patient care scenarios, focusing on developing core clinical skills, decision-making, and teamwork, even if it means using less novel technology. The correct answer is D. Design a simulation that accurately reflects common and critical patient care scenarios, focusing on developing core clinical skills, decision-making, and teamwork, even if it means using less novel technology. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare simulation education, balancing the desire for innovative and engaging learning experiences with the fundamental need to ensure that these experiences accurately reflect and prepare learners for real-world clinical practice. The challenge lies in discerning whether a simulation's novelty serves a genuine educational purpose or risks introducing artificial complexities that could mislead or confuse trainees, potentially impacting patient safety. Careful judgment is required to align simulation design with established learning objectives and professional standards. Correct approach analysis. The correct approach prioritizes the definition and purpose of simulation in healthcare as a tool for safe, experiential learning that mirrors clinical reality. It focuses on using simulation to develop specific skills, knowledge, and attitudes essential for competent patient care. This aligns with the core principles of healthcare simulation, which emphasize fidelity to the clinical environment and the achievement of measurable learning outcomes. By grounding the simulation in established protocols and realistic patient scenarios, educators ensure that learners are developing competencies directly transferable to their practice, thereby upholding professional standards and patient safety. This approach is ethically sound, as it directly contributes to the development of safe and effective healthcare professionals. Incorrect approaches analysis. One incorrect approach focuses solely on the novelty and technological sophistication of the simulation, without a clear link to defined learning objectives or clinical relevance. This risks creating a wow factor that distracts from genuine learning and may introduce artificial elements that do not reflect actual patient care scenarios. This failure to adhere to the purpose of simulation as a tool for realistic skill development can lead to a misallocation of educational resources and potentially create a false sense of preparedness in learners. Ethically, it fails to provide learners with the most effective and relevant training. Another incorrect approach might involve designing a simulation that is overly simplified or abstract, failing to capture the complexity and nuances of real clinical situations. While aiming for accessibility, this approach undermines the core purpose of simulation, which is to provide a safe yet realistic environment for practicing decision-making and skill application under pressure. Learners may become proficient in a decontextualized or artificial task, but this proficiency may not translate to effective performance in actual patient care settings, posing a risk to patient safety. This approach is ethically questionable, as it does not adequately prepare individuals for the demands of their profession. A further incorrect approach could be to prioritize entertainment or engagement over educational rigor, leading to simulations that are fun but lack substantive learning value or fail to address critical clinical competencies. While engagement is important, it should be a byproduct of effective educational design, not the primary goal. Simulations that prioritize entertainment may not adequately challenge learners or address the complex cognitive and psychomotor skills required in healthcare, thus failing to meet the fundamental purpose of simulation in professional development and potentially compromising patient care. Professional reasoning. Professionals should employ a decision-making framework that begins with clearly defined learning objectives derived from current clinical practice and established professional competencies. This is followed by an assessment of how simulation can best achieve these objectives, considering the appropriate level of fidelity, realism, and complexity. The design and implementation of the simulation should then be rigorously evaluated against these objectives and real-world clinical scenarios. Continuous feedback from learners and subject matter experts is crucial for refining the simulation and ensuring its ongoing relevance and effectiveness in preparing competent and safe healthcare professionals.